Study of health behaviors among adolescents in Tirana 2024, smoking, alcohol, drugs, and physical activity. I would like to start by recalling the definition of health by Dr. Andrea Stamper, a key figure in public health and a WHO founder. Health is a state of complete physical, mental, and social well-being, not just the absence of disease. WHO 1946. These dimensions are mental, social, sexual, spiritual, emotional, and physical. This study aims to analyze health behaviors of adolescents in Tirana in 2024, focusing on tobacco, alcohol, drug use, body mass index, and physical activity levels. It will identify social, environmental, and technological factors influencing these behaviors to provide recommendations for policies and programs that promote adolescents' health and well-being. The objectives assess the prevalence of smoking, alcohol, and drug use among adolescents aged 10 to 17 in Tirana, analyze the relationship between substance use and physical activity, identify social, economic, and environmental factors influencing these behaviors. The study tests the following hypotheses. There is a significant association between alcohol consumption and tobacco use among adolescents. Physical activity is negatively correlated with substance use, tobacco, alcohol, drugs. Social economic factors such as parents' education level influence substance use behaviors. The prevalence of overweight and obesity varies by age group, gender, and place of residence. This descriptive analytical study examined health behaviors of adolescents aged 10 to 17 in Tirana. Data were collected via a structured questionnaire in January to February 2024 from a randomly selected sample of 417 students across 3 schools. The questionnaire covered physical activity, alcohol, tobacco, and drug use. Data were analyzed using SPSS version 27. Descriptive statistics include frequencies and means, correlation and logistic regression analysis identifying predictors of substance use and relationships between social economic factors, age, residence, parents, education, family income, and risk behaviors, smoking, alcohol, drug, body mass index, physical activity. Approval was obtained from school authorities. Participants gave informed consent, and data were kept confidential and used only for research. The sample included slightly more females, 55% than males, with participants from urban 37%, semi-urban 28%, and rural 35% areas. Most were aged 13 to 17 years, 60%. About 68% had parents with secondary or higher education, and 66% were from medium-income families. Over half of children had a healthy weight, through 36% were underweight, and 7% overweight or obese. Tobacco, alcohol, and drug use were more common in older adolescents, 13 to 17 years. 7.56% smoke, 21.51% drank alcohol, and 11.1% use drugs, compared to much lower or no use among 10 to 12-year olds. Physical activity levels were higher overall, with 19.58% regularly active. Most reported 1 to 2 hours of activity daily, with no exceeded 2 hours. Tobacco use increased with age 0.73% 10 to 12 years vs 7.56% 13 to 17 years. P equal 0.000. A higher prevalence in males 5.85% than females 2.44%. P equal 0.008. The correlation coefficient between physical activity and tobacco use minus 0.068, P equals 0.004 are statistically significant. P less than 0.05. Alcohol use rose with age 1.47% and at 10 to 12 years vs 21.51% at 13 to 17 years. P less than 0.001 with an overall rate of 22.95%. It was higher in males 14.67% than females 8.3% and more common in urban 46.8% than rural 40.4% or semi-urban areas 12.8%. All P less than 0.001. Use was greater among teens with less educated parents 13.1% vs 2.2%. P equal 0.026. Strongly linked to tobacco use are equal 6.48. P equal 0.002 and negatively correlated with physical activity are equal minus 0.5. P equal 0.0395. No drug use was reported in age 10 to 12, but 11.1% of 13 to 17 year olds report use. P less than 0.001. Use was higher in males 9.65% than females 1.45%. P equals 0.005 and more common in urban, semi-urban areas than rural. P equals 0.045. Highest use 36.4% was among teens with primary educated parents, not statistically significant. Drug use was negatively correlated with physical activity are equal minus 0.37. P equal 0.049. Overweight and obesity rates were higher in adolescents 8.43% and 1.2% than children 2.4% and 0.6%. P less than 0.001. Boys had higher rates than girls. P less than 0.001. Urban adolescents had the highest prevalence through difference by residents were not significant. Overall 6.01% of the sample were overweight and 0.96% were obese. Risky behaviors, smoking, alcohol, drugs increase with age, especially among boys, aligned with the National HBSC 2022 and Global WHO 2019 trends. A strong link found between alcohol and tobacco use, supporting the idea of clustering risk behaviors. Cannabis use 11.1% was more common among males and urban youth, encouraging concerns about long-term mental health. While physical activity was reported as high, it likely falls short of WHO intensity duration guidelines. Sedentary habits Screen time, eating while watching TV were more common in younger children. Overweight, obesity was low overall, but higher among older boys in urban areas, consistent with global data. Findings support integrated school-based age-specific intervention targeting multiple behaviors together. Conclusion and recommendations. Substance use increases with age, with alcohol being the most common. Although many adolescents are physical active, some remain inactive. Sociodemographic factors like parental education and residence affect health behaviors. Early prevention and specialized adolescent rehabilitation centers are essential. A school should provide education, and families need consulting support. Policies must protect youth from substance exposure. Vocational training and public awareness campaigns are needed, along with ongoing monitoring to improve interventions.